Hi, welcome to Socialpost Health Channel viewers. I am Dr. Chava Anjaneyulu, Senior ENT Surgeon. I am working with Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is an all the facilities to diagnose and treat ear, nose, throat, neck problems, especially if there is any neck swelling, either due to lymph node or salivary gland tumor or thyroid gland tumors. We are diagnosing with blood test, radiological evaluation and FNAC, and we are treating and curing the disease. If you are having tinnitus and vertigo problem also, we have advanced cochleovestibular lab. We are diagnosing the problem and we are treating this tinnitus and vertigo. For newborn babies also, if they are suffering with any hearing problem along with speech problem, we are diagnosing their problems accurately with cochlear test, especially BERA, and we are treating these patients accordingly. If you see some patients, they may have problems of, some people suffer with the wax problem. Normal process, wax usually produced normally by the sebaceous glands in the ear canal. It is not an unhealthy disease. If wax accumulate, if wax not come out in the ear, it is a problem. If wax accumulate in the ear canal, if it becomes dry, then it will do the pressure on the ear canal skin and bone. If we neglect this wax, stained wax, it will cause severe problems like keratosis appearance and with their complications. Sometimes it will erode into the bone and cause facial nerve paralysis and intracranial complications also. Rarely what will happen if wax accumulates, it will pressure necrose the bone along with the bone, because once necrosed, that brain will expose and on that pus will form, infection will form and meningitis, intradural abscess will form. So wax most of the times it will come out. Why some people will get wax? Why they will get the problem of wax accumulation? Mainly due to the narrow ear canal. Because when there is a narrowing at the especially bony and cartilaginous portion, this wax will get accumulation and it will cause the further problems. Second most common is abnormal angulation. Usually it is horizontal, sometimes it is oblique, that whatever the produced wax, it will not come out normally. These are the common two conditions, that means stenosis or atresia of the ear canal and abnormal angulation of the ear canal. These are the two things which cause this vacuum accumulation problem. In children it is common because in children that canal is very narrow, so children may need repeated cleaning till they reach a certain age, around 10 to 14 years. After that, most of the times ear canal size will become normal and no need to further cleaning. Till that time, if they get a cleaning once in 6 months to 1 year, that is fine. Especially in adults, if they have the problem of the repeated wax accumulation, check for that narrowing of the canal. If there is a narrow canal, patient is getting frequent problems, you do the canaloplasty and the patient's wax accumulation problem will go out. If there is a keratosis appearance, we have to remove immediately that wax. Otherwise, it will erode the bone of the facial nerve and cause the facial nerve paralysis. So, in vacuum accumulation problem, in children, it is not the big issue. Get for a few years, once in 6 months, they will become normal. But in adults, if there is a canal narrowing, do the canaloplasty and get the problem relieved. So, don't neglect the wax. If you have any problem of the repeated wax impaction in the ear, contact Asian ENT Care Center. They will examine your ear canal. If there is a narrowing, we do the canaloplasty, your problem will get cured. For further updates, subscribe Socialpost Health Channel YouTube.